groups that we've always had some hesitation in approaching with an endocrine-based therapy is the group with visceral metastasis. And so at ASCO 2020, the virtual meeting, there was data presented from the MONALEESA-3 and the MONALEESA-7 trial with ribociclib, in which about 60% of that population had visceral metastasis on each of those two trials. And so they were carved out and looked at, and I think, again, maybe somewhat reassuring. I wouldn't say necessarily surprising, but I think it really, the benefits mirrored what we saw with the overall MONALEESA-3 and MONALEESA-7 study populations. We saw a 20% reduction in the risk of death in patients presenting with visceral metastasis in MONALEESA-3 that received treatment with ribociclib, and about 30% for those with MONALEESA-7. And when we carve out just those with liver metastasis, which are certainly a very life-threatening organ to be involved with metastatic disease, we saw that same improvement in outcome in both the median progression-free survival and also an overall survival benefit in those two populations. And so I think that might have been a group that many practitioners have concern about an endocrine approach, with a CDK4/6 inhibitor, which is cytostatic. Now I think we have great data that says they do just as well as the study population as a whole that may have presented with soft tissue or bone metastasis.